Hi everyone, my name is Afua Ntem-Mensah, infectious disease physician here at Faith Regional. Currently we have 2 mRNA vaccines which have been distributed. That's the Pfizer-BioNTech vaccine and the Moderna vaccine. Technically they are the same because they are all messenger RNA vaccines. Messenger RNA vaccine is basically an intermediate of the genetic material that ends up encoding for the spike protein. One may ask, what is the spike protein? So the spike protein is just a protein that's found on the outer membrane of the COVID virus, and this spike protein is so integral in the replication and entry of the virus into the human cell. So this spike protein has a binding protein on top of it, and that binding protein basically binds to a receptor on the human cell, gaining entry. So what has been done at this time basically is you create the intermediate genetic material of the spike protein that is injected into someone's arm, and basically that genetic material kind of instructs your body to encode for the protein that's a part of the spike protein. And when that happens, your body develops antibodies against the spike protein. So you pretty much have a unique form of, you have your own spike protein which is being produced in you, and your body is developing antibodies against that spike protein and kind of working to prevent you from getting COVID-19. Currently, I do know that some vaccines which are being evaluated for emergency use authorization. Number 1 is the JJ vaccine, and I know probably the AstraZeneca is also going through that process. Some other vaccines which are still in development, which we are hopefully waiting on, include the Merck vaccine, Novavax. We also have Sanofi. We have Sinovac, which is from China. Then you also have the Sputnik vaccine, which is also from Russia. Those are other vaccines which may be released to other parts of the world. The other update which I think is important is that you do not have to wait for 90 days after you get COVID before you receive your vaccination. If you get COVID and you recover from COVID, you can go ahead to get vaccinated for against COVID-19 infection. The only group of people who may have to wait for 90 days will be patients who are treated with monoclonal antibodies, either bamlanivimab or with a combination Regeneron monoclonal antibodies. Looks like COVID is going to be around for a while, and I feel that here in Nebraska, the best thing for each and every one of us to do is to encourage each other. You need to encourage your parents, you need to encourage your family, friends, you need to encourage each and every person that you can to get vaccinated. The earlier we get vaccinated, the better it will be for all of us, so that we can prevent the mutants from developing right here within our community and causing widespread infection. Thank you.